First off, we have to know a little bit about what a concussion injury is. It's a functional injury. Okay, so the structure of the brain remains intact, right? It's not like if you have a pulled muscle and you can actually go on there with an ultrasound and see that the muscle's been torn or pulled, or if you have an MRI, you can see that there's separation in the muscle, there's edema and there's swelling and all this other stuff. With concussion, you can't see that because it's a change in how the brain functions. So because of the impact or the insult that happens, the brain actually undergoes what's called a stretching and a shearing. So the brain tissue itself gets pulled and stretched. And when it gets pulled and stretched, it basically just creates a stimulation of the brain. And that stimulation creates all sorts of firing. And that's where a lot of the symptoms come from, at least in the very initial stage. All of that firing then starts to burn energy. And so the second phase of concussion is just this really, really low energy state. So the brain itself remains intact. That's why if you were to do imaging using structural imaging techniques like an MRI or like a CT scan or a CAT scan, you would just see a normal looking brain. Oftentimes, I've had patients that will come in and say, yeah, I had a CT scan done in the hospital and the doctor told me that I don't have a concussion. It's impossible to see a concussion on a CT scan. The purpose of doing a CT scan is to look for something more serious, like a brain bleed or swelling or a fracture in the skull or something like that. So just because the doctor says that your image is clear doesn't mean that you don't have a concussion injury because you can't see the concussion injury. If your scan is clear, it means that you don't have something more serious than a concussion. And that's really the whole point of doing these images in the hospital initially, is just to make sure that there isn't a bleed or something more serious. But concussion, like I said, is a functional injury. So you can't see it on an MRI or CT scan. Now, I don't think this is led to, but now we have these new fancy tools that actually look at brain function. So they'll look at and they'll use various techniques to look at how the brain is functioning, which gives us a little bit more insight into, possible concussion mechanisms and, possible objective evidence of concussion actually occurring. Because right now we have no way to confirm that a concussion has actually occurred at all. We really have no way to do that.